Hello everybody, Dr. Sue.
Dr. Kardashian.
And we're here at Artlipo, Lipedema, and Liposuction Surgery. And today we're going to talk about liposuction safety and how it pertains to lipedema surgery, because in the world of lipedema surgery, there's more and more doctors getting into it, but it's still a relatively small number. We all do things differently. And probably the biggest difference is not the instrumentation, but it's the anesthesia, right?
Correct.
So that plays a huge role in the safety. So let's just talk about anesthesia real quickly, and we're going to hit some other topics. What's more safe, using a local anesthetic or using general anesthesia?
Local anesthetic is a lot more safe than using general anesthetic.
So with local anesthetic, I can tell you the risks are very low. You got to stay within a certain limit, which we always follow. We always stay within that certain limit. And if you stay within a certain limit, I've been doing this for 18 years, the chance of having toxicity from lidocaine, which is getting a little goofy and having it affect your brain, is very low. I think I've had 2 cases in my entire career where patients started getting a little drowsy and we just put them in the hospital for watching under observation. And that's very safe, like out of almost 15,000 patients. So let's talk about the safety of general anesthesia. What are our concerns?
General anesthetic has a lot of risks, and our anesthesia colleagues are great, but anytime you add another layer of complexity, there are additional risks.
It affects the
brain.
And the nervous system.
Correct. And some people can be hazy for several months after general anesthetic. And there are also procedural
cardiovascular risks.
Exactly.
So we have to manage the anesthesiologist is there increasing the blood pressure, decreasing the blood pressure. There's all sorts of shifts up and down, and the cardiovascular risk of having a stroke or a heart attack, although it's not high, it's there. And that's not a risk of local.
And also risks of intubation.
And
teeth can come out.
Okay.
Blood clots.
Blood clots are one of the biggest risks, because with local anesthetic, we rarely would have an intraoperative blood clot, meaning a blood clot occurring during the surgery, because the patients are moving the entire time. But one of the biggest concerns with general anesthesia is when you're paralyzed under general, there's no muscle movement, and that's when blood clots can occur. So we take all sorts of precautions, doing compression boots and other things, and blood thinners and other things afterwards to try to reduce the risk of a blood clot, right?
Correct, to minimize that risk. Yes.
So many different things that general anesthesia is worth it. But I'm not saying you shouldn't have it done under general anesthesia. There's some circumstances where that is going to be your best choice too. Okay, so that's just anesthesia. Let's talk about the other risks. Does everyone bleed during liposuction?
Everybody bleeds, but the amount of bleeding is small.
And what do we do? What ingredient do we use to minimize the bleeding?
We use epinephrine.
Right. So the fluid that we put into the surgery area includes epinephrine, which shrinks the blood vessels and limits the amount of bleeding. And truthfully, it's a very small amount of bleeding. In the 18 years that I've been doing this, we've had 3 patients that required blood, and it was like 1 unit, like one little pack. So I've had 3 patients. One was, older patient, 75, and I think the other ones are also a little bit older in their 60s, because they have more fragile blood vessels. And no one was in the hospital for days, but they were feeling a little fatigued and needed to have a little boost. So 3 units of blood in 18 years that we've given, and
thousands of patients.
And like, what's a typical thing for like orthopedic surgery? You do surgery all the time. I mean, it's a pretty common thing to give patients some blood, right?
Correct.
Almost any kind of...
Especially after joint replacements.
Joint replacements, general surgery, almost all other types of surgery, you got to give some blood.
Yeah.
But just that should put in perspective the bleeding risk. Very low. Everyone bleeds a little bit, but very few people will need any kind of blood transfusion, okay? So we talked about anesthesia, we talked about bleeding. What's another big one? Infection.
Infection rates are very, very low with wide awake liposuction and the sterile technique.
So I'm going to give you the answer to this, because I've been doing this for 18 years. He's only been doing it for a year. Okay, in 18 years, I'm going to tell you the average number of infections that I have to deal with in each year, which is 500 to 600 patients a year. out of 500 to 600 patients a year, I probably have 2 or 3 infections. Little patches around an incision that we just have to give a little course of oral antibiotics for. In the last few years, probably, actually, overall, probably a more significant infection requiring IV antibiotics, maybe once every 2 years or so. So very small number. That's okay. We just talked about maybe 1 in 1,000 requiring a little bit extra care, and the majority just being an extension of their oral antibiotics. Let's compare that to orthopedic surgery or any kind of other type of surgery.
Well, yeah, a lot of other procedures accepted infection rate is about 3%.
And that's right, 3%. So let's talk about what 3% is. 3% in 500 patients would be 15 patients. So us about 3, general surgery of all types in wound healing and everything would have been about 15. So we're very safe, and the reason for that is lidocaine, which is the local anesthetic we use, has a very strong antibacterial property to it. So it makes it difficult for bacteria to grow. And there's still lidocaine in the tissues after your surgery. So there you go. Anesthesia, bleeding, infection, blood clots. Any major surgery you go for, general surgery, they tell you have to be careful of blood clots. So let me tell you what our track record has been. In 18 years of me doing this surgery, 2 DVTs, deep vein thrombosis or blood clots. No one's had a pulmonary embolism, no one's gone to the hospital or died, but we have had 2 diagnosed cases of DVT. What's your track record?
Extremely safe.
What's your track record? In general, what would be a track record in a surgery center like yours for a doctor?
A couple of percentage points, 2-3%.
From what I know, it's about, you're going to have 1 or 2 a year at least, right?
Yeah.
Is that,
oh yeah, definitely.
So 1 or 2 a year versus our 2 in 18 years. What's the difference? General anesthesia versus local anesthesia. Local anesthesia, you're awake, your limbs are moving the entire time. So the 2 blood clots we had, patients who weren't getting up, okay? So almost a month out after surgery, they're just so swollen, which is normal, but so swollen that they're uncomfortable and spending too much time laying around and not walking enough. So that's something that we always have to encourage our patients, get up and move around. So it's not impossible to have a blood clot afterwards, but it's very, very rare for us to have a blood clot. We're about 12 to 15,000 patients into, Artlipo experience, and 2 in 18,000.
That's amazing.
Yeah. So I think that covers all the big things. You know what? What we don't usually talk about risks and complications is, disappointments because of loose skin or wrinkling. And this is what we see, okay? So if our patients are disappointed because of something, it's usually because there's loose skin. Even though we prepare everybody, you're gonna have loose skin. And we do tell everybody before surgery where they're gonna see loose skin, but we make it a range. It could be medium, it could be significant loose skin. But regardless of what we tell patients, there's always some that, go, I know you told me, but I don't like it. And so that's a kind of, and bumpiness, although we're really good, there can be bumpy in some areas. And that's, those are the types of complications that we typically have to deal with.
Correct. Which is compared on the grand scheme of things and health.
Yeah.
They're not terrible.
Yeah. So you should listen to us when we tell you there's going to be looseness and wrinkling or bumpiness, and really, you got to be realistic about that, because that's the main thing that we have to deal with on a, regular basis. So I hope this has been informative. Liposuction, the way that we do it for lipedema and for cosmetic reasons under local anesthetic. All our cases are under local. We don't do anything putting people to sleep, or we don't put them in twilight or anything. Other doctors do that. Thank you.
See you later.